Mental health, according to the World Health Organization (WHO), is a state of well-being in which every individual realizes his or her own potential, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. This is the definition, but we can see how this concept, this definition, is complicated by migration and displacement. Because the very circumstances of migration and the very causes of displacement can mean that migrants and displaced population may not be able to realize their full potential due to bureaucratic barriers, stigma and discrimination, such as when migrants lack proper identification to qualify for job or social services, or displaced population experience discrimination due to their identity or political status. Migrants may also experience abnormal stressors in their country of origin, their migration path, and in their destination country. For instance, when people flee their homes due to violence or persecution and experience significant hardship along their journey. Migrants and displaced population are expected to contribute to more than one community, such as the communities they come from and the communities they become a part of due to migration. And each of these communities can hold their own expectation of the migrant, at times to the detriment of the migrant's potential contribution. It has also to be noted that for displaced population, the community back home might not be there anymore in the forms they were used to experience it, and is an additional burden. Plus, very often, there are not only these two communities, but there is also the community of migrants in the destination country, and many others that multiply the burden of having to contribute to a community, especially, as we said, when communities are not very proactive in fostering this contribution or actually are discriminating the individual. According to the Oxford English Dictionary, the adjective psychosocial pertains to the influence of social factors on an individual's mind and behavior, and to the interrelation of behavioral and social factors. Mental health and psychosocial support in the humanitarian context are instead used as a composite terms that defines any type of local or outside support that aims to protect or promote psychosocial well-being and or prevent or treat mental disorder. The idea that informs this course is that the mental health and psychosocial well-being of individuals happen in systems that include families, groups, communities and societies. For mental health and psychosocial support programs to be effective, therefore, they should be informed by a community-based approach. This is advocated in the Interagency Standing Committee publication entitled Community-Based Approaches to MHPSS Programs, a guidance note, which you will read as part of this training. If you don't know what Interagency Standing Committee means, do not worry, you will find the explanation in the reading assignments for this course. Before going into more details, let us watch an animation. Please follow it carefully and we will unfold its contents throughout this session.